Hi, welcome to Askimo TV. I'm talking today to Dr. Alessio Agostinis. Dr. Agostinis is a highly specialist clinical psychologist based in the UK. He's the principal and owner of CTT International, specializing in bespoke psychological consultations, therapy and training. Hi, Dr. Agostinis. How are you?
I'm very well, thank you. How are you?
Wonderful, thank you. Dr. Agostinis, let's talk today about depression. What is the difference between depression and sadness?
Depression and sadness. I think the first point to make is we may have very similar symptoms. Is the degree to which we experience those and the duration for which we experience them, which would make a difference between a clinical and non-clinical diagnosis. So, we all may feel a little bit blue after a night out or after the loss of someone, and that will actually often meet diagnostic criteria for depression, or after an argument with a loved one. With depression, we experience a much more significant reaction and a much more persistent reaction than we normally would.
So what would be some of the signs or symptoms that I may be depressed?
Technically, what we observed is a mixture of things. Not any one of these, the following, in isolation, will give a diagnostic criteria, but is again the amount and duration. So we would experience a loss of interest in pleasure. So things we do, we don't get the same kick from or the same pleasure from. We may not enjoy seeing our friends as much as we used to. We don't feel we can love people as much as we used to. We may have a very pessimistic view about ourselves, the world, of others. We may be very pessimistic about the future. We often observe what we call psychomotor retardation. So thoughts can be slowed down. People will go inward a lot. There'll be a change in our sleeping pattern very often. So, and equally, sleeping more or much more or less or much less are equally potential symptoms. Loss of interest in sex is also part of the diagnostic and the clinical assessment criteria. We may find it difficult to get ourselves motivated. We may find it difficult to go to work. We may feel we don't care. We may experience a sense of failure, and a key defining factor comparing depression with, say, sadness is a key sense of hopelessness.
How is depression treated, and what role does medication play in treatment?
As for anxiety disorders, very similar. Depression, should be treated. That's not always the case. Utilizing a stepped care approach. For first episode, reactive depression, so say reactive to the loss of someone, or the loss of a job, or splitting up from our partner, the first step is normally self-help. Self-help books, there are tons of these on the internet. Typically, again, the recommended basis would be one along the side of cognitive behavioral therapy. Again, looking at thoughts, feelings, emotions, and what we do in response to that. The next step would be medication or therapy, equally effective. A variety of antidepressants are prescribed these days. The latest guidance stays the same, as much as drug companies have developed a wide range of fancy drugs with very poor trials at times. The treatment of choice is typically a selective serotonin reuptake inhibitor, or SSRI, so basically an antidepressant. Often the brand name in the UK would be citalopram, and that's shown to be effective in treating depression up to 9 months and cheaper than therapy. After 9 months, therapy becomes as effective and cheaper than medication.
Are there cases where depression is normal, like if you lose your job?
Yes, again, these states, these processes, these reactions are in there for a purpose. They are not added on extras as a purely biochemical scientist might try and pitch. There are responses to stresses in the environment. The really interesting development in the area of depression is that, as for anxiety, we now realize some of these processes are quite normal, and how we respond to them makes a difference. So it may not be so abnormal, in fact quite normal to experience depression. The difficulty is what we do in response to it. We know some of the strategies that people apply that can be productive at times, like keeping busy, keeping distracted, are fantastic in the short term. However, in the long term, mean we are not processing that information, we're trying to keep thoughts out. So it's a bit like me saying to you right now, Joanne, try not to think of a pink elephant. What's the first thing you think about?
Pink elephant.
Right. Now, I often say to patients, and these are some of the examples we will give in therapy, now try and totally forget that pink elephant, or keep it out of your mind, or totally erase it. Because that's what effectively we try to do with our emotions and thoughts. What people come to realize is that the more they apply this strategy, which would otherwise work out in the environment, I can move a chair out of the way, I can move out of the way of a boss, don't really apply in our internal context. So part of the process is understanding that if that was a thought or an emotion I didn't want to have, like the feeling of feeling hopeless or a picture that I'm a failure, then by using the strategies I normally apply in my usual environment to survive, I may actually be perpetuating the problem. And so the real strategy is becoming aware of these strategies and learning to let them go.
And just a final question, who is more prone to depression, men or women, and why?
Now, we usually look at very similar rates. Sometimes, in some studies, have shown that women tend to present more with depression. Now, on the latest available, one of the latest available therapies may explain why that is the case. When we look at our brains, one explanation, which I like to subscribe to, is that the language centers in the brain of ladies are much more evolved than those of men, which of course I don't like to admit as a man. And we know that part of what contributes to perpetuating mood states, including depression, is things like the conversations we have in our heads. You know, this person said this to me, they don't like me, they hate me, I'm a failure. We know that the language, the language processes are much more evolved, much more efficient, and therefore much more productive, both in helpful but unhelpful ways in females than they are in males.
Thank you, Dr. Agostinis. Thank you so much for talking to me today.
Thank you very much for asking me.